Heard at Health is sponsored video content brought to you by MedCity News.
Hi, I'm with David Schumer, CEO of Apella, which leverages technology to solve problems in the operating room. David, can you talk a bit about the current problem facing physicians and health system administrators in the operating room?
Absolutely. Thank you for having me. It's great to meet you.
Sure.
The operating room is the financial heartbeat of every health system in the U.S. In fact, over 60% of every revenue dollar collected by a health system comes from a medical procedure, primarily done in the operating room or endoscopy suites or cath labs. Despite this level of financial importance, the operating room suffers from a lot of operational challenges that are really holding back the profitability of health systems. Specifically, 75% of every surgery starts late.
Wow.
And as much as 25 or 30% of the whole day is idle in the operating room.
So where do you think AI has a role in this?
AI is having a big moment in healthcare, and I think ambient technology is really paving a path for ways of improving the operations of the entire health system. You're seeing it in physicians' offices and in other parts of the hospital. In the operating room, Ambience has a huge opportunity to collect more data that's more accurate and more timely and actionable than what they're able to collect today.
Sounds good. There's so much choice in the marketplace, right? Why should surgery centers or health systems pick your solution compared to a competitor?
Yeah, that's a great question. I have a lot of empathy for health system buyers today who are getting thousands of emails from AI companies telling them all the ways that one technology solution or another can really improve the way the hospital performs. I think if I'm a health system leader, I would really reach out to your peers to find out what results others are getting from the technologies they've adopted. I know a lot of our customers have been willing to speak publicly about what they have found. Some customers are finding increases in surgical volume by as much as 10%.
Wow.
But others are reporting that they're able to reduce downtime between surgeries by over 10%. And I think all of this leads to less overtime and burnout from the staff. And I think financial performance and staff satisfaction are the two most important issues facing hospitals. So if you're able to find other health system leaders who have had those types of experiences, I think relying on your peers is the most effective way of making choice.
Can you talk a little bit about who your customers are?
Houston Methodist has published that their surgical volume increased 10% from before introducing Apella to after introducing Apella. Tampa General has measured that their downtime between surgeries was reduced by over 15% after implementing these technologies. I think those are really meaningful numbers when you look at the two most pressing issues facing health systems today, which are financial performance and staff satisfaction. When procedures run late, days run late. And I think if we're able to prevent that to help all of the staff get home to their families, I think that's a worthwhile endeavor.